Welcome to the first video in our Home Health Aide training series presented by homehealthaidetrainingsource.com. We are going to provide a brief overview on what a home health aide is, what a home health aide does, and what is required to practice in this healthcare field. Did you know that the home healthcare field is projected to increase in demand by over 50% in the next 10 years alone? There's already around 1 million home health aides, so that means there'll be 500,000 more jobs over the next 10 years available. Did you also know that a job as a home caregiver is a great stepping stone on your way to a more prestigious job in the medical and healthcare fields? If you want to prepare yourself for a lucrative career in a field that's only getting bigger, then you've come to the right spot. Whether you know nothing about caregiving or you're certified and looking for work, we've got you covered. So let's start with the home health aide training basics. What is a home health aide? Home health aides, otherwise known as home health care support, home caregivers, or simply health aides, are people who are charged with taking care of either physically or mentally challenged, or both, individuals in lieu of full-time hospitalization. Especially for elderly patients, hiring a health aide is an economical, and most would say a more dignified alternative to a nursing home. Health aide agencies offer a cheap way to get personal medical support that clients and families can trust and count on. Most importantly, as a home health aide, you will be making a monumental difference in your patients' lives. The one-on-one attention and support that you will offer as a personal health aide far surpasses what these clients would get in the crowded environment of a nursing home or hospital or similar institution. That means more peace and happiness for the patients and less stress and worry for the patients' children and families. So what does a home health care aide do? Throughout your home health aide training, you are going to learn to carry out a wide array of duties, from basic medical tasks to assisting in household chores. Sometimes you might be working with a licensed nurse or other healthcare professional. Sometimes you'll be working with other health aides from your agency, and sometimes you may be working alone with your patient and their family. So here are a few of the most common home health aide duties. Giving the proper dosage of medicine to a patient, helping them remember to take their medicine, helping patients change their dressings or their clothes, assisting with nutrition and meal preparation, running errands for the patient, keeping logs of the patient's daily progress and medications, assisting in the bathing, cleaning, and other hygienically related tasks, and basic housekeeping duties such as cleaning or organizing. Oftentimes, your patients will be incapable of completing these alone. Your specific duties are going to vary pretty widely from patient to patient. However, as you can see, despite the wide variety of responsibilities, most of these tasks are actually quite simple to carry out. This is why home health aide training is both cheaper and faster than most other healthcare professions. And this actually brings us nicely to our next question. What do you need to be a home health caregiver? What certifications and training is required? So what draws many people to be a home health care aide in the first place is the speed and simplicity of the training. Working as a health aide is a great way to start a long-term career in the healthcare field, and it's a great way to test the waters, really, to see if caring for others could really be your lifelong passion, and we'll talk a little bit more about this later. However, while you don't need nearly the education of a doctor, there is still a clinical training requirement to become a home health aide, so don't think you can go out and start working tomorrow. Luckily, home health aide training is both straightforward and cheap. Here are a few things you'll be required to do. Complete a physical examination, possibly including a drug test. That depends on your state. You'll need to pass a government background check. You'll need to demonstrate a nurturing and patient personality. This is important. You're going to need to demonstrate a willingness to carry out sometimes mundane tasks. You're going to have to demonstrate strong communication skills. You will need to complete clinical home health aide training that meets the requirements of the state's regulations. We'll talk about this more in a later video, but in general, that's going to be a minimum of 75 to 100 hours of training. And ultimately, you're going to need to pass a healthcare license exam. But despite all of these requirements on paper, there is one requirement that's more important than any of them. And you might be asking yourself, what's the most important requirement of being a home health aide? And the one requirement that you absolutely must have in order to keep yourself from going insane in this career is you must have a passion for helping people. Without a passion for others' happiness, you will soon burn out as a home health aide, and I can pretty much assure you of that. The home health aide training itself will require some long nights of studying, but the job itself is where things can at times become trying. If you're not fulfilling yourself in some way as a home health aide, the field probably isn't for you, and there's nothing wrong with that, but it's something you should find out for yourself. So what should you do now? If you're interested in learning more about becoming a home health aide, here are my suggestions for you. First off, go to our website, homehealthaidetrainingsource.com, where we'll answer a lot of your questions and, address your concerns. Second, go ahead and blow off your phone book or head over to Google and start looking for home health aide agencies in your city and region. Give each agency a call and find out whether or not they're currently offering discounted or free home health aide training to people interested in a job with their agency. Many will oftentimes do this. And if any of them do offer free training, then congrats. You know where to go next. Otherwise, you're going to need to find a licensed home health aide training program. The most common place to look will be around, say, a local community college. If you go out and start your home health aide training now, then in 6 months to a year, you can have a secure and well-paying job helping the people who need it most. There's no reason not to look into it if you're even remotely interested, and many people discover that helping people as a home health aide is one of the most fulfilling things that you'll ever do in your life. So this is enough for a general overview of the home health aide field. Please watch the other home health aide videos on our channel and in this series. And if you're interested in learning more about what it takes to be a home health aide, so this is enough for our general overview of the home health aide field. Please watch the other videos in this series on our channel, and if you're interested in learning more about what it takes to be a home health aide, please don't hesitate to go to homehealthaidetrainingsource.com. Thanks.